there, I'm Dr. Ruth Roberts, your pet's ally. I hope that you are all well. I mentioned in the Facebook group a few minutes ago that we're in Kentucky and it's lovely and green and all of those good things. However, the cicadas have popped back out. So we found out that cicadas contain something in their little bodies that actually make cats and dogs have vomiting and diarrhea, which thankfully is self-limiting. But Pepe was so excited to be able to catch and eat many cicadas before we could stop him, and so he had quite a bit of vomiting. So if you are in an area where the cicadas are hatching out, just be aware of that. And we've got a lot of great questions this week, as always, so let me hop over to the Facebook group and we will get going. Yeah, thanks, guys. I guess I need to. Sorry, I keep getting this thing from the software, and it's a little weird. So, May, this is if Spirit's been on pumpkin twice a day and things are not good, then and when you feed a canned food, the stool seems to get more formed. I am suspicious that there's a couple of things going on. It may be that there is a fiber that is present in the canned food that's helping to bind him up, or you're taking out something in what you're cooking that's making his stool better. So if you're on and watching this, what I would ask you to do is take a photo or send a copy and paste the ingredients of the canned food into the comment here, and then into the comments on YouTube for that matter, and then a list of ingredients of what you normally cook for him. And that's going to help me kind of compare and contrast. But my guess is that there is something like flaxseed in the canned food, or some type of gum that's actually getting his stool more solid. And if the pumpkin is just not helping, what I would do is take that out, because there are some pets with pumpkin sensitivity, and there's a couple of other options you can try. Boiled turnips, boiled sweet potatoes, and boiled white potatoes. They often have a different type of fiber that can be very helpful. Chia seeds can be extremely helpful. So you would take a tablespoon of chia seeds and add, I think, a couple of more tablespoons of water, let them soak overnight and kind of suck up the water, and then refrigerate it and use about a teaspoon of that per meal and see if that doesn't firm him up. But if you will, put those ingredients in both of the food and what you've been cooking, so I can help you a little bit more here. Oh, good. So hopefully you heard all of that. And if you've got time to drop it into the comments on the broadcast, then just do that and I'll take a look in a couple of minutes. And again, congratulations to Bettina. She's just been a wonderful support to us, and we've been able to support her, guys, so we're happy for you. Bettina did a beautiful testimonial for us too for Crock Pet Diet, and if you've got time to do that for us, y'all, I sure would appreciate it, because that helps explain what works so well for you. And I love this photo that Hannah posted. I mean, golly, it's tough to get old, and it's not easy being a dog either, getting old. So Karen's got a couple of great questions. Just Food for Dogs is very interesting. So they started out as a kitchen in LA, and Mike was there and had several of his friends whose pets ended up getting really sick. They do offer some DIY homemade kits, and I think Petco was carrying their kits in store for a while. Here's what I don't like about their food. It is extremely high in carbohydrate. So it's, back to like 70%. They do add in veggies and things of that nature. And Yeah, it's great. It's okay, but it's not ideal. But that's the whole reason you all are doing crock-pot, is so that you can control exactly what's going into the food. So the supplement with 2 a day is a taurine supplement, and then if you want to make sure that your guys are getting glandular supplements in, then I would use whole body support by standard process. And you can head over to the store. If I was smart enough, I would have looked the link up. But at any rate, I'll put that in the comments for you, Karin, and see if that doesn't help. If you've got, yeah, and they do use kelp for iodine for the just food for dogs. And then I think the big difference in mine supplement and theirs is truly the glandular materials. The link for scheduling a follow-up consultation, let me just drop that in here too, is right there. And I will be traveling back to Phoenix on Wednesday, and so the Wednesday is out, and I think I do have a couple of spots open for tomorrow, but then it'll be the following week. We'll be in Santa Fe for a bit. So, yeah, I think you're spot on with that analysis. And Jamie, you're right. I mean, this just food for dogs is definitely a step up from kibble. And, if that's the way it's going to work, whether it's these guys or Ollie or the Farmer's Plate, what have you, sometimes just shipping the food is pre-made is what it's going to take to get people feeding real food for their pets. One of the other things that really worries me about all of that is the environmental cost. I mean, there was a study not too long ago that showed that it costs something on the order of 2 times a mid-sized SUV energy-wise and to the environment itself to maintain a dog or a cat. A lot of that is due to shipping. Some of it is due to the high amount of animal proteins that they eat. And so it's one of those things that's been weighing on my mind quite a bit, and I'm not quite sure how to address it. I think crock-pot's a step in the right direction as far as using vegetables and things that are lower impact on the environment. But I mean, still, these guys need a fair amount of meat. The upside is that, that's about all we can do is keep up. And I'm looking up May's pet food as we speak. And let me pop over to this page so you can see it too, May. So you've got potatoes, sweet potatoes, flaxseed. So there's a couple of things in here that may be doing it. It may well be the potatoes, and you've got potatoes and sweet potatoes and peas, so those are all starches. So Pam, May, what I would do is try boiled potatoes or sweet potatoes and see if that's what is helping to firm up the stool, and then 86 the pumpkin and see where that takes you. If that's not doing it, then the other thing is the flaxseed. Because it's a great source of fiber, as long as your pet's not sensitive to it, then that could be a real reason. And then the other thing is that there's not a lot of veggies in here. So it is possible that some of the Brassica species veggies in particular could be creating a problem. So give that a shot and let us know if the boiled potatoes work or don't work. and substitute those in completely for the pumpkin and see if that gets you there. So let's see here. Ouch, poor buddy. So Mr. Hank has a horrible abscessed gum where a previous extraction, oh golly, and that canine tooth is fractured as well. That's very strange. I'm not sure. This is really weird. So Karen, I'm not sure if you're going to the same vet or not. You may need a second opinion. I would get them to do a biopsy of this tissue and also any bone that's in there to make sure this isn't something more serious and sinister, because unfortunately, it is that does not look good, and if it's that ugly and inflamed, there's something going on in there. I also would ask them to do a culture and sensitivity to make sure that the right antibiotic is given to knock this all the way out, because unfortunately this is in the bone at this point, and yeah, that gets to be a big problem. What can you do in the meantime? You can do, oh good, yeah, and that is another concern, Karen, is mast cell cancer. So if you can get him into the specialist tomorrow, then I'm just going to belay all of that, because the only other thing I can think of is laser, and you definitely don't want to do that in the face of possible cancer. And then Pam, you're not asking a silly question. Does it matter if it's loose? Yeah, something's not right. And so we want to make sure that it's not a food creating sensitivities that's creating the loose stool, and if it is, we need to get rid of it. But if it's not a food, then we need to look at why is his gut not working as well as it should be. Because I mean, Spirit's not an athlete. This is where sort of it can be kind of quote unquote normal, with excess exercise or really strenuous exercise. But this is not normal, so we want to keep working, on it. And so was that Merrick? And this is the dry one. Oh, I didn't. Let me go back up here. Yeah, so peas, pea protein. All right, so not so much. You do have flaxseed in there. If this is the right one. So peas, pea protein. So there's no potatoes in this one. I guess that was just in the dry food. But there are 3 gums: agar, flaxseed, locust bean gum, and xanthan gum. Let's make sure this is the right one. So is this the one that you've been feeding? And I'm gonna pop back over to questions and let you ask you to respond to that. So Karen, keep us posted on what's going on with Hank, because that's kind of ugly looking. And Jean, welcome. Antranex is very interesting. So if you're not familiar with it, we do actually have the veterinary one on the website as well as the human one. Antranex is made from this very interesting product called Yakatron, which is a liver fat extract that helps the body detoxify. And so what's said on the website from Standard Process is somewhat limited because the FTC and FDA are ugly. So here's what's interesting. So this is the human product, and the other weird thing about Standard Process products is they don't put all the ingredients in there, but you can see that calcium is 30 milligrams, and then the bovine liver fat is about 16 milligrams. Now, the veterinary product was not available when I was back in day-to-day practice, and there's sort of less information present about what's in this, but the calcium is 40 milligrams, so if we can compare that. Okay, good. So that is the same thing for Pam. All right, so I'd say you've got peas or flaxseed firming things up there, or something that's just not in there, that's in what you're cooking regularly. So if we compare this, so if we've got 40 milligrams of calcium in the veterinary product, and we've got 30 milligrams of calcium in the human product, then there's roughly 21, let's see, 30 and the 40. So there's roughly 25% more yakatron in the veterinary product than the human product. Having said all of this, this dosing schedule is what I used to use in practice. So with the human product, I would use a tablet per day for dogs under 20 pounds and for cats, and then a tablet twice a day for 20 to 50 pounds, and then for greater than 51 pounds, 3 times a day, or a tablet and a half twice a day is kind of what ends up being more effective. So they are roughly the same product back to back, so it's perfectly fine to use that. And then the other thing is that it is cheaper to buy the human product. So it's $15.40 for 90 tablets, and then $28.05, so a couple of bucks cheaper. Although I guess at the end of the day, it's all kind of 6 of a one and a half dozen of the other. So Jane, I hope that is helpful. Let's see. And Kathy, this is good news. And really, it's not so much that the jerky is dry and that's why the creatinine is going up. It's that the jerky is meat. It's protein. And so the more protein that you eat, the higher your creatinine will be. And that's not necessarily a sign of abnormal kidney function. So this is good news here. That's great about her not needing her teeth cleaned. And Bordetella is only needed if she is getting boarded or going to dog parks, things of that nature. And there is an intranasal version of that. So if that's something that may be coming up for you, then I would definitely consider that, just because it does protect against kennel cough. Now, as far as parvo, you can do a blood titer. So, and see what her level of protective antibodies are. And if you're the veterinarian you've gotten a hold of is at all holistic or integrative minded, she should be able to offer you antibody testing or titer testing for vaccines. So check that out. Kathy had another question about the heat. And yes, they can absolutely burn. And so black asphalt is worse than concrete, but still, I mean, Lolly, this is a great chart here for those of you that may or may not have seen it. I mean, when it's hot outside, the concrete and the asphalt temperature is much, much worse. So with that hot temperature, if you have no access to walking on just grass or ground, I would definitely do my walks really early in the morning or really quite late in the afternoon, so that your risk of their feet burning goes down considerably. So I hope that is helpful. Thanks so much, Lolly, for posting that. That's the first time I've ever seen it laid out that cleanly. But yeah, definitely avoid it. And what we always do, if we're someplace and we're not sure how hot is it, we will just physically touch the asphalt or the concrete with our hands, and if it feels pretty hot, Or if it's too hot for you to walk barefoot, then you know that your pups are not going to have a good time with that either. Vaccine nosodes. These are interesting. The rabies vaccine nosode has been a little dodgy, and what I have seen more commonly is people do parvo vaccine or parvo nosodes and distemper nosodes. But it's really interesting. There was a clinical homeopath, veterinary homeopath, that published a study, and what she was recommending was going to the dog park with a new puppy on a schedule of starting like 1 to 2 minutes, sort of a low traffic dog park too. This was the other key thing, and exposing them and then taking them away. And the theory is that most likely, if your pup has ever had a parvo vaccination, it will probably never need one again. And the reason is that when they are out and about sniffing, they sniff another dog's stool, and they get exposed to parvo. And so essentially what they're doing is continually inoculating themselves for parvo. Distemper, not so much, but again, I think the chances of exposure to distemper is very low, and frankly, it's one of those diseases that puppies seem to outgrow once they become adult dogs. The rabies vaccine nosode gets a little dodgy, and I think in our files, if it's not here, we'll get it added. There is a 2006 rabies compendium, 2016, and in that compendium, they discuss that if a dog has ever been vaccinated against rabies, then it is considered to be up to date, which is kind of bizarre, right? Wow, I actually went to the right place. No, I didn't. So that's where it gets interesting. I think that what is more likely to be successful is to actually use vaccine titers. So do you really need to worry about nosodes? And I don't think so. So check that out. I think titers are a better option than nosodes, because you have some understanding about how well is my pet protected. So I hope that makes sense. Great. So let's see, let me pop back over here and see where we are. Great, so we got that covered. So I hope that's helpful. Let's see here. And May, we did yeah, so I talked about this a little bit too. This is a problem. And if feeding canned food fixed that, again, there's something going on in the food that's either in the canned food that's not in Crock Pet, or that's in Crock Pet that is not in the canned food. So keep working on that, but this is definitely not normal. And I know we've talked about this before. The other thing is too, I think that you give him a rest off of frankincense and myrrh, which are very, very strongly moving essential oils. Do you notice that the stool gets better when he's cycling off of those two herbs? Let's see. And welcome to all of our new folks. So Leah, Jean, Susan Shires Combe, and Susan Riley. It's been a very a long-term client. Let's see, and I've got a couple of other questions. Bear with me just a moment here. Sherry's asking about the CBDs. And she feels like it is helping her, but she shakes a little when she gets up first thing in the morning, like she's cold. And that started shortly after the CBD, and you're using 25 milligrams a day. So Sherry, what I would do is make sure that it is not creating an additional problem. And what I would do is try a half dose for a week. So if you're using 25 milligrams, then use 12 and a half milligrams, and see if that takes away the shaking and if it makes any impact on the amount of pain and discomfort she's having. As far as other options, there are things like tea relief. There is the PEMF loop, the Assisi loop. I think we talked about a couple of these other things. And there's a handheld laser you can use at home, made by Tendolite, and I think that one's worked really well. So check that out. And then a CC, I don't think I saved this link, but let me see here. There it is, animal health. So if you're not familiar with this, what it is a pulsed electromagnetic frequency product. And it has been extremely helpful for many pets with arthritis. And Bettina will tell you that it has made an enormous difference for two of her pets, both for pain and they have a separate product for anxiety as well. Let's see here. I think I've got a couple of more questions to get answered. Susie is asking about Goldie. So she's on some thyroid tabs, Previcox, gabapentin, and about 3 milligrams of mirtazapine per day, which is keeping her appetite up. The Assisi loop, yes, it does. I'm not sure if it's potent enough, but there are human products as well, which I think there's a mat type product, Karen. And Susie's concerned about detoxing her from so much medication. And Susie, I would take this very, very, very cautiously as far as detoxing. And what I would suggest doing is supporting the liver to assist it in getting rid of garbage. I think that if you cycle from past issues, I think if you cycle off of Previcox, things really kind of go to hell in a handbasket. So I would use milk thistle, probably 100 and the capsules are weird. They're usually 175 milligrams to 240 milligrams a piece, and I would use one of those a day for 3 to 4 days. Make sure that's okay. If that works and she doesn't get sick or anything of that nature, then I would suggest twice daily for a week on and then a week off. The other thing you could consider is liposomal glutathione to help support the liver, but I would approach that with caution because it is pretty potent. And if she's got a fair load, that's going to make it difficult. The reason I'm telling you to approach this with caution is she's 16 and a half, and you're doing everything you can to just kind of keep things chilling. You're also saying that she only wants to eat meat, and she doesn't really want veggies, and so it's not really balanced. So I think, this is it. Anything she wants right now is what she gets, because that's what's making her happy, and that's what's making her stay with you in relatively happy form. So just keep doing what you're doing, and I think you'll be okay. Now, Susan had asked about Rico. They're saying he's got an enlarged prostate, which may be causing some of the issues he's having. He's scheduled for catheterization and X-ray next week, and so what they're going to hopefully find out for you is if this is, so Rico is still intact, if this is like a prostatic hyperplasia, as men get, sort of a benign thing, or whether there's some concern for prostate cancer. But most often, at his age, it's going to be more just inflammation or infection. Now, Standard Process does make a couple of products to help support the prostate, and that may be one of the better options for you. Most veterinarians will routinely just say, okay, we got to neuter him now. And sometimes that's the truth, and sometimes it's not. So there's a couple of things you could add in, and one of them is the prostate PMG, which is going to help support healing the prostate, and then saw palmetto will help to kind of support it. And for what I would do with any of the human products is use them for Rico's size, use them at half dose on the human label. So you could consider both of these, Susan, and I'll drop this into the comments. Okay, and I think that is the questions I've got for today. Let me just double check this sheet one more time. And yeah, we're good to go. Okay, so next week I will see you all. Keep the questions coming. You're doing a great job. And remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.